Hello and welcome to Cgx and Pgx buccal swab training. Please have a pen and paper ready for any main points or important dates you may need to remember. If you have any questions after the video, please contact your manager directly by phone or by email, or you can contact myself at vtcommunicationsllc@yahoo.com. Okay, let's get started. Okay, we're going to get started with definitions. The first definition is Cgx qualified specimen, or Cgx testing, and that is the DNA testing for a maximum of 39 genes, excluding lung, lymphoma, and skin, and that's to discover any markers for the predilection of cancer in the human body. Definition 2, BRCA1, BRCA2. This is the gene test that uses DNA analysis to identify harmful changes or mutations in either one of the two breast cancer susceptibility genes, which we also know as the breast cancer gene. Definition 3, pharmacogenetics. Pharmacogenomics is the study of how genes affect a person's response to drugs, which is also the PGX testing. This relatively new field combines pharmacology, the science of drugs, and genomics, the study of genes and their functions, to develop effective, safe medications and doses that would be tailored to a person's genetic makeup. 4. Swab testing. Using a certified sterile device to collect a DNA sample from a client. 5. Momentum quality control. Accesses new data entry forms from the field. They decide if the data entered is complete and correct. They correct mistakes if possible and notifies the regional manager of any uncorrectable data. They send the completed form on to the teledoc for assessment and signature. So quality control, once you completed your form goes to them. They look over your form, make sure that all the information and data entered is correct, the spelling is correct, everything is in the correct place on the form. If they can edit or correct your form, they will. If they cannot, they will send your form back to your manager to see if you can rectify the situation so that you are paid for that swab. 6. Teledoc. Doctor that evaluates the submitted form, signs off on, and may prescribe medicine based on the results, or it may be the PCP that does of the swab. Laboratory. Company that all swabs are sent to and performs all testing directed by the teledoc. Ascension. When a laboratory performs a preliminary test on a DNA sample to discover if the sample is viable. Neoplasms, a new and abnormal growth of tissue in some part of the body, especially as a characteristic of cancer. Okay, so those are the definitions of what we will be talking about so that you can understand when we say BRCA, Cgx, Pgx, swab testing, or laboratory, or the teledoc, you know exactly who we're talking about and what role they play in what you are doing. Okay. Acceptable insurances. We accept Medicare, Medicare Advantage, Medicare PPO. Again, we accept Medicare, Medicare Advantage, and Medicare PPO. We do not accept private insurance or HMOs. If that person has United Healthcare HMO, we cannot accept them. If they have Blue Cross Blue Shield and they work for the post office, we cannot accept their insurance for this Cgx testing. To be sure of what insurance that patient has, when you speak with them, you're going to ask them to present to you all the insurance cards that they use when they go to the doctor. So they may give you a prescription card, a couple of medical cards. So what you're going to be focused on is if they have Medicare, HMO, PPO, or Medicare Advantage. With Medicare, they must have a personal history. If you are doing CGX testing on a patient and they have Medicare, that's the red, white, and blue card, they must have a personal history. Meaning they either have to have cancer present or they have to have had cancer and survived. So in order for them to qualify for CGX testing, if they have the red, white, and blue card, they must have had a personal history of cancer. Now, again, to just recap, we can accept Medicare, original Medicare, Medicare Advantage, and Medicare PPO. If you are unsure if they have an HMO or a PPO and it is not on their card, you can go to Medicare.gov. That website again is Medicare.gov. And you will enter the patient's information, their zip code, their Medicare number, their last name, the day that their Medicare was effective, if they have Part A and B, and their date of birth. You will hit continue, and that will let you know if they have Medicare HMO, if they have a PPO, Medicare Advantage. It will show you on this site their enrollment status. So again, if you are not sure or the patient is not sure if they have original Medicare, Medicare Advantage, a PPO, or an HMO, you can always go again to this website, Medicare.gov. You want to go to check your enrollment and enter the information off their red, white, and blue card. Hit continue, and it will let you know that enrollment status. Once you've checked their enrollment status, if they have a PPO, Medicare Advantage, or original Medicare, they can qualify for the CGX testing if they have a personal history of cancer. We also accept Medicaid. Medicaid is accepted in the following states: Georgia, Ohio, South Carolina, Kentucky, Montana, Washington, Missouri, New Mexico, and Colorado. Medicaid is just the same process as the CGX for Medicare, except Medicaid does not have to have a personal history. They can have a family history. Again, Medicaid can have a personal or family history to qualify for the CGX testing. If they do not have a personal history and they have a family history, they must have 2 or more family members on the same side of the family, maternal or paternal, with cancer to qualify for the CGX testing. Again, Medicaid in the following states can be accepted with a family history of 2 or more family members on the maternal or paternal side of the family to qualify for CGX testing. When accepting Medicaid, we only accept the state-issued Medicaid cards. We cannot take WellSource, CareSource, Missouri Care, WellCare. It must be the state-accepted Medicaid cards. For Georgia, Ohio, Kentucky, South Carolina, Colorado, Missouri, New Mexico, and Ohio. we must have the state issued cards. If you are not sure what that state issued Medicaid card is, you can Google the state issued card. Or here is a sample of some of the state issue Medicaid cards. For Missouri, it's Mo Health Net. For Kentucky, it's KY Health Choices. Georgia, it's Georgia Department of Community Health, Georgia Medicaid. So again, if you're not sure of the state issued Medicaid card, please Google it and have that on hand so that you know what that state issued card looks like. So just to recap, we do accept Medicaid in Georgia, Ohio, South Carolina, Kentucky, Montana, Washington, Missouri, New Mexico, and Colorado. But it must be the state issued card. They will qualify for CGX testing with a family history of 2 or more relatives on the maternal or the paternal side of the family. If you have any questions to that, please contact your manager or myself directly. Cancers that qualify for the CGX test: breast, ovarian, colon, pancreas, prostate, fallopian tube, spleen, brain, bladder, stomach, liver, kidney, and testicular. Those are all cancers that qualify for the CGX testing, whether it be personal history or family history. What we do not accept is skin, lymphoma, thyroid, lung, and leukemia are not acceptable for the CGX testing. In order to qualify for the PGX testing, the patient must take 4 or more prescribed medications. And notice the key word there is prescribed. So they must be on 4 or more prescribed medications to qualify for PGX testing. The only exception to that is if they are taking an anti-anxiety medication or a pain medication. If they are taking either an anti-anxiety medication or a pain medication, they qualify for the PGX testing with that one medication. That is the only exception to PGX testing. So, to qualify for PGX testing, that patient must be on 4 or more prescribed medications or one anti-anxiety medication or one pain medication. That will qualify them for the PGX testing, and that's for Medicare and Medicaid. Okay, so now we're going to move on to CGX processing. That is how to enter a test into your patient's form doing the CGX testing. So we're going to go directly to a live CGX form. For each state, there is a separate link because it goes to each state has a different teledoc that signs off on it. So make sure that you are on the link that is appropriate to the state that you are working in. Okay, so once you pull up your form and you click on the appropriate link to the state, you're going to see this form. Once this comes up, you're just going to go ahead and hit Get Started. The first field you're going to fill out, you're going to click into that field and you're going to put last name, first name. Can't spell John Doe. First name, last name. date of birth, age, and whether it's a male or a female, address, city, state, and zip. Basic information. Anybody that done phones before or ever filled out a form with patient or customer's information basically knows this is the basic form. After you've entered all the information, each field should turn green to let you know that you are done. You're going to put in the telephone number. And if they have an email address, their email address. If not, you can just put anything at email.com, yahoo.com, gmail.com. So that is the patient demographic information. That is the first you will fill out. Then you will click the appropriate box to their ancestry. So we can put it there, African American. Then you're going to go over to this side of the field. The day that you are doing the form, it will automatically generate that date for you. If you are doing a CGX and a PGX form on one patient, you want to make sure that you have two different dates in those forms. So if you're doing the CGX form and it's dated for November 4th, you want to go in onto your CGX form and you can change the date, and we want to change that to November the 5th. Your agent code is the code that you receive for your manager. If you have not received your agent code, please contact your manager so that you can receive your agent code. Your agent code will start off with CSCW and then whatever your code is for yourself. And that's what you will be putting in where it says collected by. If you are not sure what to do next or where you need to go next on your form, you can always hit guide me and it will take you to where you need to go next. So the next thing that you need to do on here is you're going to take a picture of the ID card. You're going to tap on the field for ID card, upload attachment. You're always going to take the picture of the card and you're going to make sure that the picture is clear, legible, and not blurry, because that can hold up your process of your swabs if they cannot see the picture, cannot read the name, cannot see the birthday of your patient. So you want to make sure that all your pictures are clear. Same thing with the insurance card. You want to take a picture of your insurance card front and the insurance card back. If you are dealing with a Medicare patient that has the red, white, and blue card, and they also have a Coventry card, that's a Coventry PPO, you can go over here to this field where it says additional insurance card front and back, and you can also take a picture of that additional insurance card, the front and back of that insurance card. You're going to click into the field where it says signature, and you will have your patient sign their name. They will not create it, they cannot generate it, and you cannot sign for them. So you want to make sure that your patient is signing their name. You will click in the field for the date, and again, the date will automatically generate for it yourself. If you are dealing with a patient that has cancer, a personal history of cancer, you're going to use this form. If they just have a family history, you're going to go straight to this part of the form. So if this patient that we're doing John Doe has only a Medicaid card and a family history, and his aunt and his mother had breast cancer, we're going to make sure that we type in the relationship to the patient. If it was on the mother or father's side, the type of cancer that they have or had, and an approximate age they were diagnosed. Most people, if you're doing a family history, may not know the exact age that their family member were diagnosed. So you can take an approximate age, but you don't want to put everybody 60, 70, 80. You want to get as close to the age as possible. So we'll just put 66. After you have put in that information, and remember, it must be 2 relatives on the same side of the family in order to qualify for Cgx testing. After you put in your 2 or 3, if they may have more than 2, if they have 3, please put all 3 of them in it, because it does help the doctors and it does help the lab with complete and accurate testing. Okay, so now again, once you put that information in, we're going to go to the next section, and that is going to be the personal and family history. Now, we put in aunt and mother both had breast cancer. So on the next section, you're going to go directly to the section that fits your form. The first section is breast cancer. The next section is gynecology, colon, pancreatic, kidney, and hereditary. Since our aunt and mother both had breast cancer, we're just going to deal with the first section and answer any questions in that section that would be relative to our family members. We had no family members that were diagnosed under 45 or 35. They didn't have multiple breast cancers. They only had one. They weren't Jewish because we put them as African American. And they didn't have multiple close family members with breast and or other cancers. So we'll skip that entire section. The next section is the Cancer Patient Questionnaire. This is dealing with the patient that is in front of you at that time. If they have no diagnosis of cancer, then you know your answers are no. But you want to go down the list and read each one to that patient. Have they been diagnosed with prostate cancer, breast cancer? If they have not, then you want to answer the questions accordingly. Have you been diagnosed? They already told us they were diagnosed with nothing. The next question was, do you have any relatives that have been diagnosed with breast cancer under 45? We had no one under 45, so that's going to be no. Do you have one relative that was diagnosed at any age? We actually had 2, so we're going to say yes. And then we had 2 or more relatives that was diagnosed with breast cancer at any age, so that's going to be checked as well. Did we have a relative with prostate? No. A relative with colon cancer? No. So that is the complete cancer patient questionnaire. The next page is just information for the patient of why the testing is being done, how they will receive the results, What's the benefit of the test? What's the risk of the test? The responsibility financially they receive. What do they do with their samples once they receive it? And then the next section is the patient consenting that you can do that swab on them. So you're going to click in that field. You're going to have the patient initial. And then also you're going to check I consent. These three here are optional. You can read those to the patient and have them answer those. And you answer and check the boxes accordingly. If you don't want to, it's not necessary that it has to be done. The next point, you will click in the signature field again, have the patient sign. Click in the field to have the date populate. And as long as you filled out the patient demographics information correctly at top, if you click in the field, it's going to automatically generate the patient's name for you. The next form is just the patient's demographics again. Each field, if you just click in the field, it's going to fill in everything that you filled in at the top automatically. The next field is the primary insurance and their policy number that's on their card. You're also going to put if they had any allergies and any current prescriptions that they're taking. If they had a personal history, you're going to place whatever their personal history was there. If it was only family history, you'll place the family history here. Gonna finish scrolling down to the next page, and this is the authorization for them to use that patient's sample or their swab. And you'll just click in the field. It's going to automatically fill it in for you, the name and also the state. Signature field, date. That is the end of the form, everything that you will fill out on the form. On the bottom of the form where it says guide me, once I've finished filling in all those fields that's supposed to be filled in, this guide me will say done. You want to click on that button that says done. And also, after you click on done, the next screen that comes up is going to be for you to download a copy. You want to download a copy of that form. Please make you a separate file for each one of these forms to go in so that your computer, your phone, or your device is not cluttered with all your forms. So please try to make a separate folder that all these forms can go into them so that they are already accessible to you at any time that you do need them. So once you click done on your form, you're going to download a copy. After you download that copy, save that to your file that you build for these. Okay, so now what I want to do is to show you the complete way to do a buccal swab.
Hi, my name is Anya, and today I'll be showing you how to take a buccal cell sample. Now, buccal cell is simply a cheek cell on the inside of your mouth. Now, before you do this, it's preferable to do this before you eat, or at least wait 1 hour before, after you've eaten, before taking a sample. Now, the first thing you do is you'll take a swish of water. Now, this will clear out any excess saliva in your mouth that may damage the cells later. And then taking a swab. In this case, I'm using a Thermo Fisher Scientific sterile dry swab with containment tube. It's preferable to have a containment tube for these. Then you will label the tube with an identification number or a name. Then you'll take out the tube. And this is the motion that you'll be making. With your fingers, you will be making a clockwise and anti-clockwise motion while moving your hand up and down and side to side. Now this will allow us about the maximum amount of buccal cells to be collected. And please don't be afraid to go along the gum line. The gum line is the space between your teeth and your cheek. There's plenty of buccal cells there that can be collected. And here I'll show you me doing it on myself real quick. Now you should do this for 40 seconds. You can go over but not under. So please time yourself with a watch, your friend, or your phone. And then you just put the swab back in the tube. Now you do this do one swab with one cheek, and then you'll do another sterile swab with the other cheek. Same process, 40 seconds, same movements on the other cheek. Then you'll take both swabs, put them in a bag, and hand them to the researchers or send them to the lab so that they can be tested. And that's how you do a buccal cell sample. Thanks for listening.
Okay, thank you for watching that. So, that is how you will actually do the swab. So, once you've done your swab on your patient, you are going to take that swab and put it inside the sterile tube. And on that swab, you're going to write the patient's name and date of birth. Also, you will have a slip inside of your bag. On that slip, you also want to write the patient's name and date of birth. And you want to put that swab inside of that bag. Now, let's go into talking about what you would do with that swab and that bag. After you put your swab in your bag, you are going to wait on your paperwork from the teledoc. The teledoc will email you your paperwork back of that patient for that swab. You will then print out that paperwork that you received back for that patient with the teledoc signature on it. You're going to fold that paperwork up and you're going to put it in the slot on the side of the bag. So your swab will be on the inside of the plastic bag. Your paperwork will be on the outside slot of the paper bag. With those swabs and samples, at that point, you're going to put it in the UPS laboratory marked envelope that you received, and you will send those off to the lab. Make sure that the swab has the patient's name and also the patient's date of birth. Inside the bag, the slip inside the bag should also have the patient's name and the patient's date of birth. Please make sure that these match and that you are doing that. PGX testing is exactly the same. You're going to swab. And again, they must have 4 or more medications or 1 pain or anti-anxiety medications. If you are doing a Cgx and a Pgx testing on one patient, you must do 2 separate swabs. Again, if you are doing a Pgx and a Cgx testing on one patient, you must do 2 separate swabs. So you will have 2 swabs with that patient's name on it, date of birth, and you will have 2 separate bags, for 1 for PGX, 1 for CGX. Again, please make sure that if you're doing a PGX and a CGX on one patient, you do 2 different swabs. Okay? If you have any questions on this training or any questions on how to do a swab or fill out the form, please contact your manager by phone, or again, you can contact me at vtcommunicationsllc@yahoo.com. Thank everyone for their time, and you have a wonderful day.